Hello all. Today we can see about the topic oral ulcer. Oral ulcer or mouth ulcer is a sore that appears anywhere inside mouth. These sores are usually red, yellow or white and might have one or several mouth ulcers can occur on gums, tongue, roof of mouth, inner cheeks, inner lips. These sores are often painful and can make eating, drinking, and speaking uncomfortable. Mouth ulcer can be alarming. Mouth ulcers are usually harmless and go away on their own in a week or 2 days. But some type of mouth sores could be point to underlying health conditions like virus, autoimmune disease, and gastrointestinal issues. Type of mouth ulcers. So first type is canker sore, that is aphthous ulcer. So these are the most common type of mouth ulcer. Not exactly sure that what causes them or why some people get them more than others do. Causes include minor trauma like biting cheeks, acidic foods, and even stress. Canker sores are usually white or yellow with red around the edge. Then oral lichen planus. This condition can cause itchy rashes and lace-like white sores inside mouth. Oral lichen planus is an immune system response and most commonly affect females age 50 or older. Then leucopalgia. Leucopalgia is a condition causes white or grey patches inside mouth. It develops because of excess cell growth. Chronic irritation from things like smoking or chewing tobacco can cause it. But sometimes it happens for no reason. Leucopalgia lesions usually are not cancerous. The next one is erythropalgia. It is another symptom of smoking or chewing tobacco. People with erythropalgia have red patches that commonly appear behind their lower front teeth or under tongue. Unlike leucopalgia, lesions of erythropalgia patches are usually precancerous or cancerous. The next one is oral thrush. An overgrowth of yeast called Candida albicans causes fungal infection inside mouth. It commonly happens after antibiotic treatment or when immune system is not strong as it should. Oral thrush causes red and creamy white mouth sores on patches. Then mouth cancers. Oral cancer lesions can show up as red or white mouth sores or ulcers. These sores won't heal on their own if mouth ulcer that has not gone away after 3 weeks. So it may be cancerous. Then the next one is traumatic ulcers. These occurs at the site of injury, example from biting sharp teeth or ill-fitting dentures, and usually have an irregular shape corresponding to the trauma. The next one is infections and ulcers, example herpes simplex virus. Often begin as small vesicles, that is blisters, that rupture to form painful ulcer, frequently occurring on keratinized mucosa like the hard palate and gums for primary infection and often on the lips, cold sores for recurrent infections. Ulcers associated with systemic disease, that is autoimmune disease, Binchett's disease, that is inflammation of blood vessels, systemic lupus erythematosus, cause when immune system attacks its own tissue. Then Crohn's disease and ulcerative colitis. chronic inflammatory condition, inflammatory bowel disease that affects the lining of the digestive tract. Then infection, viral infection is caused by herpes simplex virus and bacillus host virus and HIV. Then bacterial, that is tuberculosis and secondary syphilis. Next, inflammatory conditions, that is inflammatory bowel disease, reactive arthritis and vitamin deficiency. Next, we can see about the clinical manifestation. So first we can see the appearance. So appearance are like sore or lesions, shape, color, size and location. Then pain, tenderness, burning sensation, swelling, difficulty in oral functions, irritation, bleeding, taste alteration. Causes of oral ulcer: minor tissue injury from dental work such as heavy or a cavity filled, accidentally biting cheek or tongue, allergic reactions to certain bacteria, wearing braces or retainers, using harsh toothpaste, eating lots of acidic food such as oranges, pineapples, hormonal changes during periods, stress, lack of sleep. Diagnosis: visual examination. First of all, we can see the visual examination, then palpitations of the regional lymph nodes, complete blood count, ESR, biopsy, patch test. Management for oral ulcer: most heal on their own. Common mouth ulcer treatments includes antiseptic gels or mouth rinse, steroid ointments like triaminoline, immunosuppressants in severe cases. Drink plenty of water, practice good oral hygiene, avoid hot spicy food. Thank you.